Dear students, welcome back. In this session, we are going to discuss about suprarenal glands. The suprarenals are paired endocrine glands which are richly vascular and yellowish pink in color. Okay, and if you see the situation, they are situated on the superomedial aspects of the kidney. Okay, and each gland lies in epigastrium at the upper pole of the kidney in front of the crus of the diaphragm, opposite to the vertebral end of the 11th intercostal space and the 12th rib. Okay, that is the location of the suprarenal glands. If you see the shape, the right suprarenal is roughly pyramidal in shape, and it is having an apex, base, an anterior and posterior surface and medial border. Okay, the left suprarenal is semilunar in shape and it is having anterior surface and posterior surface, an upper end and lower end, and also the medial border. This is about the shape of the suprarenal glands of right side and left side. Okay, if you see the size and weight, each gland measures 50 millimeters in height, 30 millimeters, 50 millimeters in height, 30 millimeters in breadth, and 10 millimeters in thickness. It is approximately 1/3 of the size of the kidney at birth. Okay, and once it becomes 1/30th when the baby becomes an adult. Okay, it weighs about 5 grams. It weighs about 5 grams. Okay, this is about the size and weight of the suprarenal glands. And if you see the subdivisions, each gland has an outer cortex and inner medulla. Cortex and medulla are entirely different in structure, function, and development. The medulla forms 1/10th of the size of the cortex. So the outer one is the cortex and inner one is the medulla. The outer cortex, which secretes a number of steroid hormones, and the inner medulla, which is made up of chromaffin cells and secretes adrenaline and non-adrenaline or catecholamines. So these are all the subdivisions of the suprarenal glands. Okay, now we will see here one sheath is present. The suprarenal glands are immediately surrounded by an areolar tissue containing some considerable amount of fat. Okay, outside the fatty sheath there is a perirenal fascia. There is perirenal fascia. Between the two layers lies the suprarenal gland. The two layers, here you can see, the two layers are not fused above the suprarenal. Okay, and the perirenal space. So the perirenal space is open and it is continuity with the bare area of liver on the right side and subphrenic extraperitoneal space on the left side. Okay, the gland is separated from the kidney by the septum. Here you can see the septum. The septum separates the suprarenal gland from the kidney. Okay, now we will see the relations of the suprarenal glands. Okay, yes. Here, as we know that if you see the right side, so right side suprarenal has pyramidal in shape, and it is having an apex and the base, and it is divided into two areas. So here the anterior surface towards the right, which is the area related to the inferior vena cava, and this side it is related to the liver. Okay, liver. And then three borders which is having anterior, medial and lateral border. If you see the left gland upper end is close to the spleen, okay, and the lower end presents hilum. Left vein emerges from here. Okay, these are the relations on the left suprarenal gland in the upper end and the lower end. Okay, so on the right side, if you see the anterior surface, it is related to the inferior vena cava. Okay, inferior vena cava and bare area of the liver. Okay, and if you see the anterior surface, so this part is the anterior surface, which is related to the cardiac end of the stomach as well as pancreas with splenic artery. Okay, and on the posterior surface here, in this, the posterior surface, which is related to the right crus of the diaphragm as well as the right kidney. Okay, and if you see on the left kidney, it is related to the left crus of diaphragm and left kidney. Okay, so these are the relations on the anterior surface and posterior surface. Okay, and if you see the anterior border of the right side is related to the hilum and right vein emerges. Okay, and medial border is related to the celiac ganglion and lateral border is related to the liver. Okay, and if you see the medial, no anterior border is present in the left suprarenal, and the medial border is related to the celiac ganglion and lateral border is related to the stomach. Okay, so these are the relations of the suprarenal gland. Okay, now we'll see the arterial supply. So the arterial supply of the suprarenal glands is done by superior suprarenal artery, which is a branch of inferior phrenic artery. Okay, and also the middle suprarenal artery. So it is having superior, middle and inferior suprarenal arteries. So the superior suprarenal artery is a branch of inferior phrenic artery, and middle suprarenal artery is a branch of abdominal aorta straight away, and inferior suprarenal artery is a branch of renal artery. These are the branches which supply the suprarenal gland on both the sides. And if you see the venous drainage, each gland is supplied or drained, each gland is drained by one vein. Okay, the right suprarenal vein drains into directly inferior vena cava, and left suprarenal vein drains into first left renal vein, and then it drains into the inferior vena cava. So right suprarenal vein directly drains into inferior vena cava, and left suprarenal vein drains into left renal vein, and then it drains into the inferior vena cava. So this is about the venous drainage. If you see the lymphatic drainage, these suprarenal glands, the lymphatics from these suprarenal glands drain into lateral aortic nodes, okay, which is seen in thorax. Nerve supply, it is mainly supplied by myelinated preganglionic sympathetic fibers, that these fibers supply the medulla of the suprarenal gland, and the chromaffin cells which are present in the cortex, okay, they are supplied by the postganglionic sympathetic neurons. So these are all about the suprarenal glands. Thank you.